Hello, you're watching Vibrant Living, where we bring the medical experts into your living room to help unlock the secret to the fountain of youth, to help you feel better, look younger, and have a more vibrant life. Today's topic is all about replacing missing teeth with dental implants and restoring the hopelessness from dental despair. Please join us at the Vibrant Living studio, Dr. Justin Wright. Dr. Wright, thanks for being here.
Thanks for having me. It's an honor.
So for those who don't know about you, where is your practice located?
We have two practices. One practice we have a surgical center in Waxahachie. We also have another large practice in Corsicana, Texas.
And this is just south of Dallas, right?
That's right. It's not very far from Dallas, and short drive and not very much traffic either.
Now, based on what you do, I know, and we're going to talk all about that today, about restoring some of the most broken down smiles and giving people their life back.
Yeah.
I know you pull patients from around the area, but you have patients coming in from all over.
We do. We have people that drive a really long way. We have some people that fly in, and you know, it's a pleasure to treat all of them. It truly is, and it's just neat to see our practices blossom in the word of mouth, and people, you know, they have friends and they say who did it or whatever, and then they come in. So the amount of trust is big with our practice, with me and my patients. And most of my patients are my friends. So,
is that right? Wow.
I mean, it's just, it's fun. It's fun. I'm making new friends every day and getting to change lives.
I want to talk a bit about that. So let's talk now dentistry. The topic is about restoring confidence from dental despair. Who is your typical patient down in your practice?
You know, we see all sorts of different gamuts as far as people. We see, you know, we have nurses and teachers and plumbers and college coaches and some celebrities, and all of them are just a different story for each one of them, and they're just as special as the next. And so we see people who have gotten burned, who have gone to other places or more of a corporate chain type of cookie cutter thing.
What do you mean burned?
Burned in that they've dropped tens of thousands of dollars into their treatment thinking they were going to get one product. Maybe some of them were trying to go a cheaper route or something like that too. And now we have to start all over again and put them back on the track that they actually can be functional and healthy. And
so a lot of your patients you see are people that have been elsewhere, things didn't work out like they should have, and you're kind of fixing the mess. Is
Unfortunately,
that right?
It's not good for our industry for that to happen, but the reality is we have a lot of patients that think that they're going to a great option, and it turns out that it wasn't a good option. It turns out there wasn't anybody standing behind what they said they were going to do. They just did some plug and play kind of deal, and anyways, we hate to see that, but you know, we don't really focus on the past. We just look towards the future, and one of the great things is when my team and when a patient walks in, it's just really fun because we see the end in sight right when they walk in. The 3D really shows us the rest of everything else with our technology, but we don't know the life change it's going to be, but we know what it's going to look like, and that's fun.
I want to put a slide up on the screen because I know you see a lot of people where this is their reality. Yeah. Take me through the typical day of someone who's sitting at home with their teeth in a jar.
So what happens more times than not is they jump out of bed and they don't want their spouse or anybody else to see them without their teeth because it totally changes their facial structure and makes them all look all sunken in and everything. And so they go in there to pull their teeth out of a glass, much like that, and then they're trying to put glue into it, trying to get it to somehow stick somewhere, and maybe one every now and then will stick, but by and large the lower ones just aren't going to stick very well. And then they go in, they're going to grab breakfast, and it's going to be something soft. It's not going to be something crunchy and healthy that they enjoy biting into, because quite frankly they can't bite into it.
And that's because just because they're loose, or what is the reason?
Yeah, they're loose, and there's no way for if you have any type of stickiness whatsoever, it's going to dislodge it. So they're just, you know, sometimes they hurt because they're all, you know, jabbing down on the side and the gums, because there is no support other than the gums just kind of holding it in to some degree with them flopping around. So it's not a whole lot of glamour to dentures whatsoever, really at all. Very few cases do we see in today's world that those patients really couldn't have a total different quality of life away from a denture.
Now, you told me over the phone, you said that you don't believe that anyone should be in a loose-fitting denture, that it's outdated technology.
I think in almost all cases, they can choose a much better option out there, which is not a denture and implants instead.
What about a psychological or emotional aspect of the fact that your teeth are just, like you said, sitting there with glue and gravity?
Sure, whether we like it or not, people look at us and they judge us without even thinking about judging us by how we smile, how we speak, what our appearance looks like. Those are just innate human characteristics that happen, and so it's really hard for a lot of people's self-esteem with if they know that their teeth could fall out any minute or flopping around. They can't eat, they're covering, a lot of dentures don't look very good, and they're covering their mouth and, chewing. Going out to eat in public is just not a great option with them because at any point in time it can come out,
So you're talking now about better options, and you are one of the top providers of dental implants. And people are flying around to come and see you. Yeah. And I want to talk a bit about that. Now, you sent us some actual cases, and you sent us more than we could talk about. So we picked some of our favorites.
Yeah.
And I want you to share with the audience about these people, because these are real people that you see every day. Let's talk about this patient here.
Yeah.
What was her concern when she came and saw you?
Well, let's start with this, Colin. Is one thing is like the situations that happen in life are very vast, and so we don't judge what those situations are other than if it's going to affect something for the future medically, because what's behind us is behind us. We're looking forward to the future. So the things that do these types, this is very common, that she should not feel bad at all.
You see this all the time.
Yes, this is a fake smile. She's doing her best for us, and this is a real smile. You can tell by looking at her eyes. A real smile versus...
Cheeks are pulled up, eyes are squinting.
Absolutely,
okay.
Absolutely.
So what are you saying? You're saying when someone comes in and they're not happy with their smile, you almost have to force them for a photo
Absolutely.
like this.
Yeah, they don't want to smile. They've been covering their mouth with their hand or all sorts of different things, or they just won't smile at all. Just keep them covered up with their lips. You see it. It's a reality. It happens all the time.
It's almost like they've adapted to just living life hiding everything.
That's right, which means they're not giving people a real smile, which also covers their heart that they would like to express to a lot of people.
What do you mean by that?
I really feel like most people want to smile and they want to be happy, and I realize that we go through hard times, but still we still want to express ourselves and be happy about things and laugh with other people. And so when you're not smiling, it's harder to have that joy and that happiness in life.
So that's what you're talking about earlier, the dental despair. The people that come see you, it is a feeling of despair because of that reason.
They don't want to leave the house. They don't want to go out in public, and they'll do anything they can to disguise that, including not smiling.
So it's a no judgment zone. People come to see you.
Absolutely.
And you mentioned earlier, it's not about where they're at, it's about where they are going.
We're looking to the future. I don't want to see the past. I don't want to see the past records. I want to see where you're at, and I want to make the change from here on out, because we see it. We see it already.
So tell me more about this patient.
Sure. So Angie is special to us. She's a single mom, and she has a precious daughter, and her daughter, she's not smiling. She wasn't smiling, and she's like, I want to be a positive influence in my daughter's life, and I'm moving on a new pathway, and I want to be able to smile again. I want to be able to have quality relationships. I want people not to judge me by this, or me having to hide it by that, which means she's not smiling in public because she's scared to. And so this was just a neat case, because Angie, we fabricated her new teeth, her new smile. She shows up, and we put her to sleep, and then she wakes up after we put the implants in, and these teeth don't come in or out, and then
they're fixed in place. They're not
they
gonna pop out.
They don't come out. No, she has no insecurity to worry about anymore. She can go chew. We want her on a soft diet at first, but really not
during
very
healing. Sure.
Exactly, while she's healing. But after that, really, she can go chew anything she wants.
So besides eating, obviously I can imagine how difficult it'd be to eat in the previous condition. But you're saying now, with the new fixed teeth with implants, Anything's on the table.
Yep, go for it.
Now, one thing that I'm seeing is with the new smile, she looks 10 years younger.
It does it almost every single time, and we're always amazed because we don't necessarily know what that's going to look like. Part of it has to do with the patient's smile and just that, hey, they have a genuine smile. Now, and the other part is just how much of their personality did it change because now they don't have that self-consciousness.
I want to walk you through this next one here. This is one of those
yes.
amazing transformations. Tell me about this patient.
There's so many of them, Colin. But this is another favorite. Lupe would not leave the house. She didn't want to be around her family and friends any longer. And she's got a neat heart, a super neat heart. So Lupe, after we put her teeth in, these are her healing teeth right here, and they are screwed in. They won't come in or out either, Colin.
Through the dental implants
Exactly.
fixed in, okay.
Exactly. Mm-hmm. And so a lady comes in 2 weeks later after Lupe's appointment and gives me this big hug, and I'm like, hi, I'm Dr. Wright. I'm glad you're here. And she goes, I know. I'm Lupe. You gave me my teeth 2 weeks ago.
No way.
And yeah. And
you didn't even recognize her.
I didn't recognize her. And I felt it was kind of embarrassing, but at the same time, what a cool story. Anyway, I dismissed myself and cried in the back room and then came back out. But that happens a lot because this is way more than just teeth. This is about people's lives changing. Mm-hmm. And it's fun.
Hi, my name is Lupe, and I am one of Dr. Wright's patients here in Corsicana. I was very, very unhappy with my smile. Just wasn't happy with the way that I looked, to the point where I really didn't want to speak that much to people, and I think I came across as maybe being a little rude, but it was just because I really didn't want to open my mouth and have a conversation with anybody. Stayed away from family functions. And not because I didn't want to be there, but I just felt so uncomfortable that I found it easier just to stay at home. I kind of wanted to crawl under a rock. I never ate a corn on the cob because I probably would have lost a tooth in there somewhere. Well, when I came in, I was excited because I knew when I left there that it was going to be something totally different. It's, actually so much nicer than I thought it was going to be. And the experience, everyone here at Dr. Wright's office is awesome. I mean, I just love everybody. They made me feel like I was their only patient, and that's the honest to God truth. I just felt so comfortable. Comfortable enough that, my husband is here now. I loved what I was seeing, and I thought, this is what I've been waiting for such a long time. I'm ready to go anywhere and do anything because I feel so comfortable. I feel, like I said, I feel like myself, like I used to be before my teeth started just going crazy everywhere. That it's just completely changed my life, and I love it. If I had to do it all over again, I definitely would do it. I would recommend, if anybody's going through anything, with their smile and that they feel so uncomfortable, it's just so worth it to get it done and feel like everybody deserves to feel happy, and I can't tell you how much I love my smile now.
Okay, so amazing transformation here. I want to go over the next case photo that you sent us. I believe this was Benny Lou.
Yeah, Benny Lou.
Tell me a little about her and what was her concern when she came and saw you?
Well, Benny Lou and I hit it off right off the get-go. Her relative is a hygienist at another office, and she brought Benny Lou to us because they found out what we do. Mm-hmm. And so Benny Lou's she's a go-getter. She's always going to be out there and rocking and rolling and having fun and active. And so anyways, Benny Lou came into us like this. And she had, I don't know, 3 or 4 teeth remaining on the upper, and then all the lower ones were pretty well gone as well. And so she needed a fresh start with everything, be able to get back out there and do what her personality does best, which is have fun.
Sure.
And she's been through a lot, and it's been fun to watch. And her case was pretty difficult. She didn't think she had enough bone, and we had to rebuild some in there. But you know, honestly, Benny Lou's happy with her teeth, and that's all we really care about.
Well, you can tell, again, another forced smile it looks like, and this one, it doesn't even look like the same person to me.
Yep. And she left that day. This is 2 weeks later, but she left that day with all of her teeth screwed into place.
In one visit.
One visit.
So someone like Benny Lou
Slept through it, woke up, teeth in place.
in just one day.
Yep.
Okay.
Just one
Now I
day.
know a lot of people today are so busy, and when they hear about dental implants or they want something like this, they're thinking they are going to have to be carted all around town to go to one specialist to get this done, that done, and a lot of people don't have time for that.
I don't have time for it.
Exactly. Neither do I. Right? Is this something they can do all at your office under your care?
Yeah, that's one beautiful thing about it is it all stops here. We take care of them in total. There is no confusion. I've seen that as far as quarterbacking around. Can we work with other people? Absolutely. We're happy to. But when patients find us, we can do everything from start to finish right here. Imaging, getting their teeth in, sedating them, all of that stuff is taken care of. All of the follow-up care that needs anything that needs to take place with that, we've got you covered on that. So Benny Lou, we removed all of her remaining teeth. They were badly broken down. Then there's a lot of spaces that obviously, as you can see right here. So we basically put in all the anchors, implants, and while she was asleep, and then we gave her new teeth. We screwed them into place. We had our teeth already made ahead of time, and that's just the process with it.
So this is a brand new set of brand new teeth fixed into place. These aren't the kind she's have to pull out and put the goop in and again worry about sneezing them into the lid.
They're not bulky. They don't go up on her gum tissue or anything like that. They're just where teeth and gums really are supposed to, except brand new. It looks like a veneer case.
Amazing, and you can tell the transformation. She looks like she's having now teeth to match the personality.
That's right. That's exactly.
And
right.
you said again, this is something I know a lot of people would probably worry not wanting to leave your office with no teeth for a while. She can come in and have this done and not leave without teeth.
I don't want them leaving without teeth. It's my name that's on it. I want them to have a smile of some sort when they leave my office that they can feel confident in it.
And so for the older generation, like you mentioned earlier, that isn't just retiring on the front porch. They're getting out.
They are. They're active. They're out there going and doing, and they're on social media all over the place. So, you know, I can't keep mom from spying in on me. They're all in social media and things like that. So, no, life doesn't need to end at the end of retirement. You know, it keeps going, and you can choose to be a healthy lifestyle and have great teeth that you can eat good foods, and then there's the other crowd.
So she's taken probably her first selfie for the social media. Probably pretty happy about that one.
That's right.
Amazing transformation. I want you to take me through this next case here that you sent us.
Yeah.
Tell me about this patient and when they came inside. What was their concern?
Sure. Well, you know, he came in with his bride, and we took my team said, hey, we need you to take a look at the 3D scan to evaluate a patient for all on 4 teeth in a day.
Teeth in a day, okay.
And I said, okay, I'm happy to. And he had heard from other people in the community, which happens oftentimes, and it was at the end of the road. And so, you know, I liked him, I trusted him, and he felt the same. And man, next thing you know, it was 2 weeks. I think it was 2 weeks later, and we were getting him set up with implants and teeth all right there.
You can see a lot of, the picture's a little hard to see, but you can see a lot of decay and worn down teeth. Is that something that just happens as we age, the wearing of the teeth and breaking
absolutely
down?
And it's nothing to feel bad about. It really isn't. So, but he needed a fresh start. And the cool thing about this case is he walks differently.
Is that so?
I hope this doesn't embarrass him, but he walks in differently, more confidently when he came in for his post-operative and when I've seen him after that.
And that's from the smile, just from, again, getting something they can
Had a
be
good
proud
personality to begin with. He just came in with one with much more confidence.
So this was taking out some infected teeth and some broken down teeth, all in one visit under sedation.
Yep.
Now let's talk about the sedation here. Now you mentioned that people can come in and sleep through this. And I know a lot of people, like me included, are deathly afraid of dentists.
Yeah, absolutely.
Do you see that a lot? And how do you help those people who are scared to death?
People feel bad about their fear, and I get that because we see it all the time, Colin. So but we have people throwing up in the parking lot. We have people just, tearing up the couch, in our living room, I mean, all sorts of nervous. And then obviously the most common is avoiding at all costs.
Just don't come, yeah.
And those are our favorites, to tell you the truth. And the reason why is because they look back and they go, man, that was not that hard. And you're like, yeah, because we give them a pill ahead of time, because I don't like an IV going to my arm.
Sure.
It kind of creeps me out. So we give them a pill ahead of time,
to just relax them? Is that
to relax them, and they don't remember very much, even the IV going in
right?
most of the time. And if they do remember it, they don't care.
So for someone who's put off this for 10, 20 years because of fear, maybe they had a bad experience when they were younger, this is life-changing.
It is. It is absolutely life-changing. They all have the same story in common, which is, I just wish I'd done it earlier.
That's their one regret.
I just wish I'd done it earlier. Yeah. I could have had, you're telling me that I could have had this a long time ago? Yeah. You didn't have to have the toothaches. You didn't have to hide your smile. You didn't have to not smile at people and laugh with people. You didn't have to be embarrassed.
Really remarkable story here. If you're just joining me, I'm here with Dr. Justin Wright from Just Wright Dental in Corsicana, Texas, just south of Dallas. And we're talking now about giving people basically their life back through a new smile. I want you to walk me through this next patient here. This is probably one of the most incredible transformations that I have seen doing this show. Tell me about this patient and what was going on here.
Sure, this is one of my best friend's fathers, and he had gone through radiation therapy.
From cancer, is that right?
From cancer, yes, absolutely. And so he had whipped the cancer, which is awesome.
Amazing.
But he, as you can tell, the salivary, the flow had just dried up, and so his teeth, it didn't matter what he was going to do, it was just still going to fall apart on him. So anyhow, my buddy Mike worked on him over and over because he was just scared to come in, probably in denial. Also didn't understand what all was going on either, was having headaches constantly as well.
And that was from the decay, maybe from the...
Yeah, that's a great. So when we took the 3D scan, which tells us, it kind of opens the door and shows us all sorts of things, it's real important. We could just see just rampant infection, not just decay, but infection where it was eaten away inside of his bone, like bubblegum ball size infection all through the bone. There was just, obviously, somebody's immune system can only do so much. And so that was just absolutely taxing his health in a lot of different ways. So it was not just, we want to give him a new smile. It was that we medically need to be able to get him back healthy again. Yes.
And you said he was another one of your big high fear patients.
Big time. He wouldn't come in. I mean, Mike literally worked on him for years to get him just to come in the door to meet me. Obviously, he wasn't able to eat like what he wanted to with what he had. So we removed everything. We got down to a fresh level again, removed all the infection, added some bone here and there where we needed to, and we added implant anchors on all of his upper jaw and all of his lower jaw, like so many other ones that we do. We had his teeth already fabricated, already ready to go. It's a different type of material than most other people use, and so it's very resistant to breakage. And then we just screwed him into place. And when he woke up, he was smiling and ready to go.
Amazing.
So, yeah.
Now, obviously, cosmetically, this is the first thing that stands out to me. What a cosmetic transformation. Was to him, was it about the cosmetics though?
No, I really don't think so. Not in his case. A lot of people it is. His I really do feel he knew that he was at the end of the rope as far as his health went, with what was hurting him, what was infected in his, his next moves were going to be to the emergency room for when those things were to blow up on him. And we see that with patients all the time. They've been in the emergency room several different times for different toothaches and things like that, when really and truly, hey, let's get to the bottom of this thing and make a healthy choice and rock and roll and move forward. You have that choice.
You do. And you mentioned that even if you're afraid and if you put it off for too long or many, many years, you feel the sense of hopelessness. they can come in and just sleep through the whole procedure.
That's right. That's right.
Amazing.
And here's something else too, is everybody thinks that, and including me, that this is going to be a very, very painful procedure. And the reality is, on a scale of 1 to 10, most of our patients, when we ask them, hey, you know, a day or two afterwards, hey, how is everything? They'll normally say a 2 or a 3 on a scale of 1 to 10. So not that bad, which always amazes me. And the only thing I can really figure out as to why that is because everything's elevated above it. Whereas if you have a denture, immediate denture put in place, it's bobbing up and down on top of fresh extraction sites, whereas this is elevated over the top of everything. So I think that's why it's really uneventful. Some patients, and I don't want to say this across the board, but some patients just say, I didn't take a pain pill and I had very minimal soreness.
Is that right?
Now, some people will swell, but as far as pain, we just don't see a lot of that at all.
Such a remarkable transformation here, and like you said, I mean, not just cosmetically, but be able to give him his health back and the ability to, you know, smile and be healthy again. As a dentist, to see that, what does that do for you?
I mean, this is my passion. This is everything to me, and standing behind the patient and getting them something that they're healthier with and happy with and proud about. That's what I do this for.
Amazing.
I do it because I have a passion to give people a life transformation.
So, Dr. Wright, if there was a final message that you wanted to share with our audience, what would that be?
It would just be my heart, which is, if we are passionate about life change, we are passionate about making people smile again, we're passionate about getting people healthy again. And I have a whole team that I really care about. I have a ton of respect for, and they're here to serve you. And the people that are looking for quality, in that if you've been battling, if you already whipped cancer, if you're getting ready to go into it, if you're stuck hating a denture, or it's just time for a change and a smile you can be happy about again, then man, we are just right up your alley, and we would love to meet you. I want to sit down and talk with you first, because I think trust is huge. Trust is big with us, and we would love to meet you.
That's all the time we have for today. I feel like we could talk about this forever. You've got so much amazing life-transforming photos that you've sent us, but that's all the time we have. I want to thank my guest, Dr. Justin Wright from Wright Dental down in Corsicana, Texas. If something today has struck a chord, and like you said, if you're looking for quality, if you're looking for someone who cares with the ability to do this all under one roof, I want to invite you to reach out to the team at Just Right Dental down there in Corsicana. Thanks for coming on the show.
Thank you, Colin. I appreciate you having me.